Hey everybody, welcome to this week's video. You remember my friend Courtney from a year ago? She was so brave in telling her story about hair loss and what she's been doing to treat it as well as style it. And now we're taking it one step further. We're here at the Office of Nigro Dermatology. Courtney wants to do PRP, so we're going to walk you through that treatment. I get so many of you asking me about hair loss and what the options are. As you know, minoxidil is a big one. We're going to link Courtney's first video because there were so many steps and so many things talked about. I really want you to see that first before we launch into this one. But this is about PRP treatment and who is a candidate for it. And in between the time of the last video and now, Courtney is my head of marketing and social media. So yay! She's not only a friend, but she's my boss lady. She runs the show and I am so thrilled and so excited. Also, I am thrilled to have Marjorie Nigro back and Jim Nigro. They do the procedure here at Nigro Dermatology. So we're about ready to get started. How you feeling?
Feeling good. I'm excited.
You ready?
Nervous,
a little nervous?
Ready.
Okay. All right. Well, we're going to get going. And I think the first thing they're going to do is a blood draw, right?
Yep.
Okay.
Yeah,
let's do this.
Hello.
Okay.
So we're all here, patient, nurse,
Yes.
the two doctors.
I know.
So we are here to talk to you guys a little bit about the PRP for hair loss. Jim has been doing a lot of cases. I do them too, but he does much more than I do. And explaining pretty much what it is, why. Courtney has been wanting more hair forever. So we're like, okay, your time came. Let's take care of you now. So we are starting the procedure with our nurse, Daisy.
So PRP refers to platelet-rich plasma, and what our specialized equipment does is it separates out the platelets and preserves the platelets, which are the main feature of this treatment. And when we do that, we end up removing red blood cells, and then we inject the plasma with all of those very nutritious platelets back into the scalp. And this procedure, once the blood is drawn, it takes about 10 minutes to spin down the blood, and we draw it back up into another syringe. And the procedure itself actually takes anywhere from 3 to 5 minutes, so it's very quick.
You know, Jim, I have a lot of women coming to me and
Yeah.
saying, what can I do about hair loss? And it's interesting because we traditionally, when we think of hair loss, we think of men and male pattern balding, but women experience it, especially in midlife, because of hormones. So are
Correct.
women good candidates for PRP? And is PRP alone a good treatment, or does it have to be in conjunction with something else?
Well, first, yes, hair loss affects both men and women. The medical term is androgenic alopecia, and basically that means alopecia or hair loss secondary to a genetic propensity to lose hair. Women, in fact, in my opinion, are better patients for this because they typically come in at a much earlier stage in their hair loss journey. And so
They're not trying to regrow half a head of hair, is what you're telling
exactly. And unfortunately, I have to tell some men that they're basically too far gone for this, and it wouldn't be fair to, suggest that they would grow enough hair for them to be impressed. Younger women, all women, but especially the younger you are, I think the better chance you have to get a great result, because everything about your scalp, your blood flow, your body is more receptive to treatment at a younger age. So there's
We heal quicker, don't we?
and we heal quicker and we respond better. So I actually treat college students. This can affect very young men and women, and they do quite well.
Courtney is in her 20s and has been experiencing this for the past 2 years.
Exactly. And regarding whether or not, you should choose PRP over other treatments. Typically, patients who come in for this procedure are using other treatments for hair loss, whether it's minoxidil, hormonal treatment, vitamins. And our feeling is that all of these treatments actually have different modes of action. So one does not supplant another. They all work together. It's synergistic because you're not going to stop, for instance, stop getting a result from minoxidil if you do PRP. It's only adding to a good result.
Got it. Okay, it's like compounding interest.
Exactly.
Yeah.
Exactly.
So now I guess we're going to spin the blood.
We're going to spin the blood.
All right.
We got
Yes.
the blood. That's
It's-
awesome. Okay.
It's very important to spin the blood to separate the part of the blood that has all the other blood cells. You do not want blood cells other than platelets in the scalp. And it could even be worse if you inject blood in the scalp. Blood is inflammatory and it could cause even more hair loss. So it is very important to spin it right and the right type of machinery. And we'll show you guys after the blood is spun how obvious it is that all you have is platelets. There's absolutely none of the red cells, the white cells, they all come to the bottom so we can have something really pure. And platelets are really wonderful. I mean, this was like discovered many years ago that once you have a big injury, like a knee injury, even a heart attack with injury to the heart, first cells that get to the area are the platelets, and they release all their factors to help rebuild tissue, to help the tissue to heal well. So it is also used in many cases for knee injuries. Patients will have surgery to recover them faster, and so platelets work for that. They kind of recover everything. So when they go to the scalp and they see roots of hairs that are kind of sad and not very active and all of that, they will stimulate those roots no matter the cause. We've been having a lot of patients over the past year that had a severe hair loss from COVID because COVID, such a huge hit in your immune system that a lot of times it completely arrests the glands and you don't grow hair anymore, you drop what you have, or hormonal causes of hair loss. So no matter what the cause is, it will just stimulate the hair roots to come back in and produce more hair. Here's the lab. And here is the machine. And so Daisy put that tube in there, and now we are going to spin.
Okay, so Courtney's blood is spinning. This
Right.
gives us a chance. We've got 8 minutes, we'll
Yes.
use less, to talk and kind of break down as her blood is breaking down. Who is a candidate for PRP? How long does it last? What kind of hair growth are you going to see? And is it one and done, or how many treatments do you need? And I'm going to let y'all go after all of that.
So you can
Well,
start.
the first thing I do with a new patient is, in a sense, manage their expectations. And what I tell them is, if you look like you do today, 10 years from now, that's a win, because we know what's going to happen if you do nothing. And in fact, your hair is going to be thicker. Are you going to look the way you did 20 years ago? No. But if you want to keep what you have, this is going to really help you do that. And that's really the same thing, the same situation with other hair treatments. Unfortunately, we don't have the magic bullet yet. But this, this is good. Our patients have been extremely happy. I've been doing this for over 5 years. I have a very high retention rate. And in fact, I've had patients who have kind of fallen off the wagon, and we'll talk about maintenance, but patients who stop doing the treatment and then they come back because after a year or so they realize they're losing their hair again, like they were before PRP. You were asking about, is it one and done? Unfortunately not. And those of you who have experience with minoxidil, for instance, which is, of course, the oldest treatment for hair loss, you know that if you stop using it, you're going to lose what you gained over all of the years that you use minoxidil. The same is true of PRP. So we basically start with 3 treatments, spaced 1 month apart. And in fact, the way we offer it, we do an extra treatment. So we do 4 treatments over a 3-month period. And then you have to come back. And we have patients, and it's standard across the US for patients to come back every 6 months for maintenance treatment. So it's 2 treatments per year after the initial 4.
Because in a way, what you have to think is, Jeanette, the majority, let's talk about male baldness, and like I tell my patients, there's 2 forms of hair loss, right? And medically, they have fancy names, but basically, one is what we call good, that you can recover much more, and one is kind of bad, that is kind of harder to recover. The good one is what we call telogen. Telogen is the kind of hair loss that happens depending on several factors in your life. Stress, hormone changes, getting sick, having a baby, nursing. COVID is a huge one.
Yep.
So those hairs, and we do a microscope exam as soon as you come in to check what kind of hair loss you have, and we can tell under the microscope, and it's an easy test. So basically, I try to tell patients that the way it is, see, a hair that you're pulling and it's not coming out, if you looked under the microscope, this hair would be, this is the hair follicle, this is the skin, the roots of the hair are open, eating from all these roots, and you can't pull it out because the hand is open. All those roots, elongated roots, are eating and keeping the hair in. As you have stress, hormone imbalances, problems in life with your health in general, you start to curl up those roots. So this is a hair that falls very, very easy. And under the microscope, we call the aspect of this hair cotton swab. And it really looks like a cotton swab. And I make sure I show all my patients that to tell them, see, you have potential for that. Those recover much faster because, of course, all you need is to kind of open up those roots to eat again and to start producing good and healthy hair. The bad one is called the anagen hair loss. That hair loss is the hair loss of men, and what happens with that is the root becomes atrophic. That means it's smaller and smaller and smaller. So when you look at the hair comes in thick, just like the hair on a telogen, but instead of making into a cotton swab, it makes in what we call a rat tail. So it gets a skinny, 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 and that's the hair that falls off. So that hair is showing that the root is damaged.
Does that person have any shot at benefits from PRP?
Yes, they do.
They do.
Yes, they do. For sure they have it. So what I tell patients, everybody benefits. But as Jim said, in different degrees. You know, you're not going to have, you're going bald, you're genetically prone, father bald, lots of bald people on the mother side of the family. You're not going to have the gigantic hair that you wanted to. But as Jim said, at least we can stop the process or revert the process in some people. And it makes a huge difference because nothing else can do that other than talking about hair transplants. And this is like a huge deal, putting hairs back and forth. This is a procedure that is clean cut, natural, based on your own growth factors from your own body, injected in your roots, that will help you produce the healthy hair you want to produce. We've had amazing results, and we've had results where patients are like, okay, it's better. Not, I could get some hair to close the little bit of almost bald spot. I'm cool with that. And maintenance is necessary because, as you can imagine, genetically, your genes are going to continue to try to destroy those roots and make those roots weaker. And so you have to kind of do a boost once in a while. I am a big believer, like what Jim said, of doing more than one thing. I think just like when I treat wrinkles, brown spots, you treat every aspect, you can of that process. There's not the one silver bullet that is going to fix everything. So every patient with hair loss should be in a vitamin. There's wonderful vitamins, even some prescription vitamins that can help you get more nutrition, because you want that hair to eat more. If you have more nutrients in your blood, more nutrients for the cell and for the hair root. We always recommend Rogaine. It is a huge help, and what Rogaine does is to dilate the blood vessels that feed the hair root. So when you have more blood, you feed the root more. The root goes better. It's a new FDA-approved deal that happened over the past few months. We are now allowed to give minoxidil by mouth in very small doses that don't have side effects, because as you guys know, the opposite is what happened. We found out minoxidil grew hair because minoxidil was a medication for blood pressure years ago. So people were taking, it's a great medication for blood pressure. It works by increasing the size of the blood vessel so the blood pressure comes down, right? And so these patients were starting to see all weird, like hair growth, and no one was understanding. And so at the end, when they did studies, they realized that this process increases the blood vessels of small blood vessels like hair areas. So it became now for blood pressure, very few people use it orally for blood pressure, but the research was done in very, very small amounts of minoxidil. The point that is not going to affect your blood pressure, you're going to be completely normal, it's not an issue, and it will help that dilation. So we have been giving that to patients to go with the treatment.
With the treatment. I mean, Jim, you can speak to this because you know men who have gone through hair transplants. That is an expensive procedure.
Absolutely. It's very expensive, and you know, that's a decision for an individual patient. But for a patient who isn't that excited about spending a significant amount of money,
it's
much more,
right?
Oh, it's
maybe it's more
tens,
than it's 10,000
or
10,
more,
really? Okay.
Yeah. So, you know, I'm not, you know, this is obviously a much more affordable way to approach hair loss.
And what does it cost?
So basically, the cost, at least in our office, and it's pretty standard, we offer a package of 4 treatments for $2,900. We really discourage patients from buying one treatment because you are absolutely not going to see results from one treatment. So if patients do not want to buy a package, then they're charged $1,000 per treatment. So you're really saving over $1,000 with the 4 treatments. And then maintenance treatments, which begin 6 months after your 4th treatment, are currently $625.
Okay, and then how often will somebody have to come in to maintain?
Every 6 months.
But it's because I mean the price may still be scary to a lot of people. It's a lot of money, and
yes,
you know you're doing it in conjunction with other treatments. If you are combining it with minoxidil, with supplements, you know, with a whole program, can you spread it out to 1 year, or will it not be effective if you do that?
You mean the 4 treatments?
I mean, yeah, so your basic follow-up treatments, instead of doing it every 6 months, could you do it every year if you were doing other
Yes, you could, depending on
so.
your results,
so.
right?
Yeah.
Some patients will have great results and they grew a lot. I tell them, keep watching. If you're doing okay, no problem to push it. If you start noticing, wait, because you notice the difference. You see more fall, you see that the texture is getting a little thinner. Then you come back earlier for us to do a touch-up. But the first package of treatment should be every month. That's what the studies all recommend, and that's what we do. So 3 treatments, and then we give a little break of like 3 months, do the 4th treatment, or for some patients who are kind of in a hurry, you do the 4th right away. and then you give them the 6 months. So the package is the best deal because then we get all, when you get all the tubing, you get it all before, you're getting one treatment for free basically, and you're paying less for all individual treatments.
Well, I think a lot of women may also opt for this if you're allocating where your money is going. Hair for women is symbolic of their beauty, their youth, and it's an emotional attachment. And I think a lot of women might forego other treatments in lieu of this one,
That's
especially if
exactly
they're
right.
starting to see results from it. And I bet that's something you see in your practice here.
And I really have seen a number of patients who have, quote unquote, fallen off the wagon and have stopped treatment, whether it's been here or they had it elsewhere. And they come in and they're like, I want to do this again because I didn't do it for a year or two and I'm noticing the loss again. And we do it and they're happy.
Yeah. No, and it's the thing, right? It's not like the majority of people are going to say, so I'm not going to do anything. You talk about extensions, $600-700 more sometimes of the extensions. And although I love the look of extensions, I don't have anything against them. If that's all you're doing, they will weaken the roots that you are attaching them to. The same way as a lash extension, anything fake that puts weight in a structure that is already damaged, like the roots of your scalp, will pull more hair out, will increase the breakage, will increase. So sure, I don't have a problem doing extensions for an event, doing something, but really, you really want your real hair. And the extensions, you pay all that and it's gone, right? This is something like a big makeup. You go to a big party, you use that, you have great hair, and then don't use it as a regular treatment for hair loss because you will end up with less and less hair on top of that.
Great. Well, I think Courtney's blood has spun.
Yes.
Okay.
Let's see. Yeah.
Okay, so here's our sample after it's spun for 10 minutes. And you can see 3 levels. One is your red blood cells, your white blood cells. Right in this yellow portion is your plasma, which is basically what makes your blood a liquid. And throughout the plasma are all of the platelets, which really don't have much of a color. And what Daisy's going to do is she's going to withdraw only this segment of the sample, and that's what we're going to inject. And one of the pluses about PRP is there's nothing foreign going into your body, right? There's no chance of a reaction. There's no side effect per se. This is your blood. These are your platelets.
No, and I'm sure everybody's thinking, oh my gosh, it's going to be so painful. It's all these shots in the head. So we use a very powerful numbing system based on cold. So there's a machine right here, and that machine is going to blow some cold air as we are injecting. So we're going to, as we are doing the treatment, pass this very cold air. And cold air, as you guys know, is very numbing and kind of relaxing so the patient doesn't feel the sticks. And at the end, she kind of does a little around of the scalp just to finish it off. Okay, Courtney, we're going to put some light here. So here we'll start. So there's really like not a specific place you have to inject. Platelets are movable. You inject it on the center top of the scalp and they will spread all over the place. So you don't have to be nervous, oh, exactly here. They go anywhere.
Yeah, so, we're going to just do a little cleaning of the scalp. The one great thing about the scalp is because it's so vascular, infection is extremely uncommon. And, I've never seen anything like that from PRP. And as Marjorie said, the anatomy of your scalp is such that the plasma diffuses throughout, so we don't have to target areas of hair loss. So I typically inject in rows across this portion of the scalp. So Courtney, here we go.
Cold. Yes.
We're going to do a little cooling first, and I'm going to pinch you a little bit to kind of distract you, and here we go. So that's what it feels like. You're doing wonderfully.
She's so tough.
I know.
And she's thinking about all that beautiful hair she wants to have, so it makes sense.
Okay. The second of 4 syringes, so we're already 30% done. How are you doing? It's okay. Some patients learn to listen to music to distract them, so they put their
Yes.
earbuds.
In a month,
And
earbuds.
Yeah.
Such a
the
good-
really nice thing about this is, although I know from experience that this is a little uncomfortable, but as soon as we're done, there's
It's
really
over.
no lasting discomfort. The sensation is one of pressure, which is strange but not painful. And patients can go right back to anything that they were doing. They can go back to work, they could go to the gym. The only thing we ask is that you not take any aspirin or non-steroidals like Advil, ibuprofen, for discomfort, because those, as most people know, can cause bleeding. And since we are poking you, we don't want to enhance that risk. We're done.
That's it. Yay, you did it, girl. We made
So
it
now
through.
we're going to clean you off. And go ahead.
Here we go, poor Courtney. She did so good. So basically now the platelets are in. So I always like to do a little massage after. You can wash your hair right after. There's absolutely nothing special. You can wash, style. Some patients say, can I have my hair dyed tomorrow? Absolutely no problem. You can have anything done. The platelets are inside. There's nothing that will get those platelets out, and you will not have a problem with anything. So if you have pain, Tylenol is the option because it does not increase bleeding in any way. So that's very good, Courtney.
Do you want to sit up?
Yeah. Now you.
What the injections were like and how you feel just a minute or two after?
It was definitely uncomfortable. I wouldn't say intolerable. Obviously,
You didn't
saw it.
flinch.
Yeah, it was good. I don't know. It's kind of an indescribable feeling because it's going into your head. It's like not anything you've experienced before. Definitely wouldn't hesitate to do it again, though. You know, to get the results that you want. You know, was it pleasant? No, but it was quick enough that I think it was good to go.
Right.
Yeah.
And you'll see they're really, I mean, later this evening, you're not going to really
Yeah.
notice anything.
Yeah.
Will she feel anything? What you mean? Like
No.
you said, all she needs is Tylenol, and that's about it, right?
Most people don't even take
Really?
Tylenol.
Amazing.
Oh yeah.
Like
Oh,
right
yeah.
now, it just kind of feels like someone's like pulling on my hair.
Yeah.
Like,
Yeah.
and not like just like a little bit, you know, it just feels like
Right.
pressure.
Right, and that will fade quickly,
Yeah.
and it's a very rare patient who finds it to be very uncomfortable, and it's almost unheard of for a patient to say, oh, that evening or that day it was really unpleasant. I mean, I would say basically never. That never happens.
When will she start seeing results
Ah.
from this?
There you go.
$10,000
Well, you know, when we
tomorrow.
started doing this
Yes.
5 years ago or so, we were, you know, we take photos, we take before and after. And so in the beginning, we were taking photos at 1 month and we were looking at the photos. And of course, you don't see anything at 1 month. What we've learned is that you really see a major difference at your first maintenance treatment. Because if you think about it, if your hair is the hair that's going to grow is new hair. You have a lot of hair, you have long hair. We know how fast hair grows. So how much hair are you going to notice in 3 months? Not very much. But when patients come back at that 6-month follow-up, that's where you can really show them, okay, here you go. Do you think it's worth it? Do you want to continue? Most patients do.
So Courtney is treated today. We're so happy. It's over. It's all good. We need to see her in a month. So we will be following up on that in a month. We'll do another treatment for her. And then, so we are, this treatment March, we're going to do one in April, one in May. And then June or July, we'll do the 4th treatment for her. So that's the way we expect to start seeing results in the summer. So July, August, she should start seeing some kind of volume recovery. She should start feeling that some hair is coming up. Of course, she's also doing minoxidil and doing vitamins, and we might start with some oral minoxidil to help that too. So she's doing kind of everything you need to do to get the maximum benefit from the treatment. And guys, talking about hair and all of those things, the last thing I want to leave it as a message is that hair and skin are part of a whole body, right? So we can't just look at your scalp and just look at your skin, then just look at your moles. Everything goes together, right? So when I see a patient with hair loss, I always ask about what's going on in their health in general. Have you been experiencing weight gain? Have you been experiencing not being able to lose that weight? Have you ever had a test called an A1C? That is a test that shows the relationship with insulin in your system. Insulin is a hormone that if it is not the right amount for the right person, can create havoc on your system. It gives you symptoms of depression. It causes you to gain a tremendous amount of weight and not be able to lose it. It damages the hair follicles. It makes hair grow on the wrong places. You start to have hair coming out of the chin of places and you start losing the hair here. It can cause terrible cystic acne. So every time that we see things like that, let's just focus not just on the one item. Sure, we're doing the PRP, we're doing all this, but I recommended for Courtney to get an A1C tested. If her A1C is a little bit higher, obviously she's not diabetic. So I know everybody's gonna say, but I'm not diabetic. Sure, but a higher A1C can create a lot of other issues before it causes diabetes, right? I always recommend a great diet. Make sure you're eating plenty of protein. I mean, either vegan protein if you don't eat meat, but this is really, really important. 5 servings of protein a day. Don't forget nuts are protein. Don't forget cheese is protein. Yogurt has protein. Really, really cut down on drinking sugar, guys. This can just hurt your hair, your skin, your body. I know juice tastes amazing. I'm from Brazil. We grew up on juice. But juice raises your insulin levels so high to kind of kill all that sugar you absorbed. As I was just telling them, we are born with a juicer right here. You love orange juice. Eat the orange. Make the juice here. Don't drink from the outside. When you drink juice, almost 100% of that sugar is absorbed immediately, creating a huge peak on your blood sugars. When you eat the fruit, all the pulp of that fruit grabs a lot of that sugar, so your peak is more rounded versus being so high. And so you should avoid that. Avoid the sodas that are too sweet. Anything, every time you're gonna eat or drink something, flip to the back on the nutrition facts and see how many carbohydrates it has. Sometimes it says sugar, 2 grams, 3 grams. But as you know, carbohydrates turn into sugar as soon as they hit your stomach and they get absorbed. So always look in carbohydrates. Don't eat or drink snacks that have more than 25. They're loaded in sugar. You can go for, there's lots of things, drinks that have a little bit of sweet taste to them that don't have a high incidence of carbohydrates. That would help everything.
Perfect.
Yay.
Yay.
All right.
I know. You're such a trooper.
We did it.
How you feeling?
Good.
You're good?
Yeah.
Okay.
Yeah.
I have learned a lot. You know, I'm grateful that you were able to get a treatment that you've been wanting to do, but I've learned a lot. There were things that I didn't know, like Marjorie was saying about A1C and hair loss, and so many different things to look into and so many different ways to treat. And it's just my hope that you get the result that you want, but also that you get information that you need and can help guide you to find a practitioner to ask the right questions. That's the most important thing. If you approach anything from a place of knowledge, you're more likely to get the results that you're looking for. And so I thank my friends at Nigro Dermatology, always a wealth of information and so helpful. So we're going to do a follow-up. We will post it on YouTube and on social media, and I just can't wait to see
Yes.
all of this hair coming in.
Yes,
I
me
mean,
too. I'm so
stunning
excited.
as it is, but it's a personal journey. And I mean, I can look at Courtney and say you're perfect, but we all have our own definition of what it is that's going to make us feel beautiful.
Yeah.
So
I'm so excited. Can't wait.
Yay. Okay. Till next time, everybody.
Bye.
Bye.